All right, good morning. If we could take our seats.
Can we have everyone take a seat, please? We're going to get started here momentarily. Thank you very much.
Were you in the military? Because I'm telling you, you're like one of my chiefs. Did great. Good morning. Welcome, welcome, welcome. I'm Donald Gintzig, and I have the distinct honor and privilege of helping to lead WakeMed Health and Hospitals. And we are so excited today to recognize, honor, and celebrate what we think will likely be one of the most important projects this community, and community local, community at large, community statewide, and hopefully an incredible example for the country of what partnerships can do to address the mental and physical health of our community, our state, and hopefully our nation. So, a lot to do, a lot to talk about. Very exciting. It's also important to recognize that on a day that it's raining, I think there's as much symbolism as what many in our community are facing, right? Darkness, rain, but at the same time, the sun comes out. Things improve. And so today, we're very excited to help kick off a transformative project. And with the help of our partners at the state, federal, and local level, we'll be able to make this a reality. Now, my family's been involved in mental health their whole life. My mom was a psychiatric nurse at a state hospital in Maryland, so I grew up with that. And things have evolved and things have changed, but it still is something that we can and will do better at. People think the pandemic kind of brought it to, but it was a crisis and a challenge and an underserved need in our community long before we even knew what COVID-19 was. And your WakeMed, my WakeMed, our community has worked really hard to try to meet the needs and reduce the pure suffering that's taking place in our community. The pandemic made it worse, right? The pandemic made it worse. We were fortunate to have a state facility right here in Wake County that responded to efforts to try to deinstitutionalize, which was a great approach. But with that came the needs in the community for more resources, and those didn't always follow the effort to help patients spend less time in an institution. And so that created more stress in our communities. But more important, less resources for our patients, those in need, to be able to have their needs addressed. And so we've seen the numbers. Tens of thousands of patients showing up in our emergency rooms, lost, scared, suffering, going to the only place that they feel in crisis they can get some help. And WakeMed, as this community's light on the hill, saw the majority of those. Young, old, the one thing I can tell you is I don't think anyone in this room or anyone outside this room doesn't know someone either in their family or a close friend or a business associate or a neighbor that hasn't faced the challenge of a mental health related crisis. The suffering, the loss, the uncertainty, the what do we do is as prevalent and as crippling as any physical trauma or crisis you could go through. And so our community, our WakeMed, my wonderful organization that I am so blessed to be able to be a part of, has stepped up and said, if not us, who? I think for years it was like, well, if we just don't look, it'll go away. If we don't talk about it, it doesn't exist. Let's focus on heart disease and all the other things, all important. But we also know that it didn't go away, and it's not going to go away, and it's going to take us together, working hard, being bold, being innovative, to do things that have never, not to boldly go where no man has gone before. That's copyrighted, and I would never use that. But to take steps, to try new things. And what we are extremely excited about is working with this amazing community of Garner to do something that you don't find. You don't find a community and a health system working together to address whole person health. The physical, the mental, the spiritual needs of a community and our patients. And it takes partners to do that, and it also takes money. Now, nobody wants to pay more for health care. Anyone want to pay more for their health care? No. But when we don't address the health needs of our community, we pay. We pay with suffering. We pay with what our businesses have to go through. We pay in what our governmental resources, from the emergency medical system to our police force to our jails. We pay. And so what we know is that health costs less than illness. And so when we can come together and do something that helps address the health of the whole person, the cost today helps significantly reduce the cost tomorrow. So, big numbers, big money, but I can tell you the return on that investment from a pure business standpoint is 2, 3, 4, 5, 10 to 1. The return on the investment in reduced suffering is 10, 20, 100 to 1. And there's no greater purpose in the world than to reduce suffering and help people live healthy, wonderful lives. So, we're here in Garner. Just an absolutely amazing community. We have a healthplex here, right? Freestanding emergency department. And from the day we opened it, and I was here for that day, it's been busy. I would say that that little old emergency room, not too far from here, probably sees more patients than half the hospitals in North Carolina, which is why we have been awarded a certificate of need to build an acute care hospital, and why once we received a certificate of need to build a mental health and well-being hospital, we sat down with the leaders and said, what can we do in Garner? And I'm going to tell you, there's as bold and visionary a team in this community as you will find anywhere in this country, and we are deeply honored to be a part of that. So I'm going to introduce the mayor, and then Congresswoman Ross, and retired Congressman Price, and Chair Thomas are going to get up and talk to you all, and we're going to get a check. And there's a drive-through branch of a bank around here, and we're going to try to put that in the little slot as we go forward. And then our Chief Medical Officer for Mental Health and Well-Being, Dr. Micah Krempasky, is going to get up and talk. And we're going to hopefully be inspired and excited, and there'll be more news coming about who we're partnering with in the near future, but today is to reflect and celebrate what it takes for a community and partners to come together to transform the future for the people of our community. So, are you ready? All right, well, without any further ado, I'm going to introduce our partner, the wonderful, honorable Mayor Marshburn of the town of Garner. Your Honor, welcome, and I'll turn it over to you. Thank you so very, very much.
Thank you. Thank you. Thanks so much, Dr. Gintzig. And it's not often that I get the title of the Honorable, so I'll live with it as it is. I was wondering if I would see some sleepy-eyed people here today. I am told that an event occurred at the PNC Arena last night that went unusually long. Unfortunately, it didn't end the way we wanted it to, but there'll be times for bounce back, we hope, and we, as I would say with our other fans here in Garner, go Canes, okay? You may have noticed when you came in this chamber that there's a name up at the top of that says Ronnie S. Williams. And so I think it's proper today for me to remember my predecessor and former long-term serving mayor, Ronnie Williams. Ronnie was a hometown guy here and served as mayor, I've forgotten, over 20 years, I guess. But anyway, we wanted to honor him with his name there. And Ronnie used to like to say when we had special events that were happening in Garner that those are red letter days. And so I would say to you that if he could be here with us today, I think this would classify as one of his red letter day events for sure. So on behalf of the town of Garner and the town council, I'd like to recognize those folks sitting right here. There are 4 of them with us this morning. Thank you for being here. And for all the rest of you who are here, there's so many faces that I know, a few that I don't know, so look forward to meeting all of you as the event takes place today. I think to say that we are pleased with WakeMed's announcement to build a whole-person health campus at a prime location in our town, I think that's probably an understatement. After some initial meetings a few months back, and before any final decisions were made, we were already beginning to envision the significance of the announcement made here today. This mental health and well-being hospital, along with an acute care hospital to be located on the same site, will provide Garner, our town, and surrounding counties with easier access and enhanced medical care, health care that will be a huge benefit to our growing area. I should mention that our current population is about 35,000. Some people said 34. I think it's probably closer to 35. I talked to my planning director yesterday. He said you can use the term 35. At any rate, the point is that we are growing. And there's a projection that this town will exceed 40,000 in population even before the facility is open. I have seen some projections that indicate that the town of Garner will grow to a population of 50,000 by the year of 2030. You know, at one time that used to seem a long ways off, but that's only 7 years. That's only 7 years from now. So in addition to healthcare services, this facility will be positive for our economy as more and higher paying jobs will become available. Garner is emerging as a job center for medical support facilities, professional services, manufacturing, and distribution. As the number of employees increase, the need for access to a hospital likewise increases. And so this new campus will reflect the fact that the mind and body are inextricably linked, and that science is increasingly telling us that the health of a community depends equally on both. For example, according to experts, people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases than the general population. WakeMed will be an anchor in a unique 288-acre site planned as medical mixed use, and this will bring better health outcomes to Garner and to all of Wake County. And so with that, I say welcome WakeMed and the important services it will provide. We are pleased to be in partnership with you. We look forward to continuing and expanding our relationship. And on behalf of the town, we welcome this exciting news, and we pledge our support as this project moves forward. And again, thank you for being here today, and Godspeed. And oh yeah, Deborah.
Well, good morning, and this is a wonderful day. I'm Congresswoman Deborah Ross, and I am just so excited to be joining you today. I want to begin by recognizing many people celebrating with us. Of course, WakeMed, which does so much to promote healthcare in our area. It has been expanding, and the leadership is dynamic and so caring and reflective of our community. And I know we have people from the WakeMed board here. Please raise your hand if you're on the WakeMed board. Thank you for your leadership. Obviously, our WakeMed president and CEO, former Congressman David Price, who I loved serving with and who's been my mentor. Wake County Board of County Commissioners, Chair Shinica Tomas is here. Who are the other members of the Wake County Board who are here? She'll introduce you, but we have 4 board members and former board member, Sig Hutchinson, I saw, the town of Garner, and all Wake County officials as well as others. Thank you for your fantastic work in getting this project to where it is. Without your hard work and dedication to improving health care and mental health care in Wake County, we would not be able to celebrate this momentous occasion. Funding for this project is a testament to what we can achieve when we come together across all levels of government to care for our people. Since my days representing Garner in the General Assembly, I've been working to secure funding for mental health, and most recently for WakeMed's Mental Health and Wellbeing Hospital as a member of Congress. And I'm thrilled to be here today to recognize the next phase of this critical project. Last year, I requested funding for 15 community projects that were developed by the people and for the people of Wake County. And at the end of 2022, President Biden signed funding for these projects into law, delivering an historic $26 million back to our community. From Cary to Garner to Wendell, these projects reach people and places across Wake County. And today, we are celebrating one of the largest recipients of that funding, along with former Congressman David Price. We worked on this together, and we are delivering, as you can see, $6 million for the new WakeMed Mental Health and Wellbeing Hospital. And what a better time to celebrate than during Mental Health Awareness Month. And we're all wearing our green, and this actually is the color of this Congress. Mental health awareness color for this Congress. This $6 million in federal funding comes alongside an additional $6 million in funding from Wake County, which Chair Thomas will discuss in a few minutes. For over 60 years, WakeMed and its dedicated staff, doctors, and nurses have been serving our community and providing Wake County residents with exceptional care. And I cannot thank WakeMed enough for your commitment to improving access to care in our community. You make a profound difference in people's lives every single day. And as we've heard, the COVID pandemic just exacerbated the pressing needs for mental health care. Many in our community who were already struggling with mental health challenges had nowhere to turn. Just this month, a new report from Human Service Research Institute found that instances of mental health and substance abuse treatment have risen over 40% in the last 5 years in Wake County emergency rooms. These statistics represent an urgent call to action, and thankfully, WakeMed is stepping up to the plate, but it always does. By establishing a hospital solely dedicated to mental health care, they are working to meet the growing and often unmet needs of our community. When completed, as you've heard, the facility will provide 150 patient beds to address the rising incidence of mental health and substance abuse in Wake County. It will provide the full continuum of care to adolescents, adults, and geriatric patients and substance abuse users of all ages. The funding cannot come at a better time. Before I conclude, I want to take a moment to acknowledge the work of former Congressman David Price, a true lion of our Congress. As the chair of a powerful appropriations subcommittee last term, he worked day and night to secure funding for transformational projects like this one. I'm grateful for his leadership and his partnership in getting this funding across the finish line. And I look forward to seeing the positive difference this project will bring to the many lives it will change for the better. Now it is my privilege and honor to turn it over to my friend who we miss dearly in Washington, Congressman David Price.
Thank you, Deborah, for those generous words, and thanks to all of you for coming together and letting us celebrate this way. This is a kind of a combination. It's partly Old Home Week. I mean, goodness, we all seen our friends, but there's also a kind of look toward the future and a sense of what the future holds and the kind of leadership that's going to benefit this community going forward. So that's a good thing, and it's nice to have everyone together, and I appreciate being able to join the group. You know, I don't know that there are too many announcements like this that I would rate as more important than what we're doing here today. This is about as good as it gets, where an urgent, I would say desperate, community need is being addressed by a determined community response. And this time, federal funds are part of the solution. That's, for an appropriator, that's about as good as it gets. And it's very satisfying to be able to be part of this action. It's going to require a lot more money. It's going to require a lot more participation, many moving parts. But we're setting it in motion here today. And that is worth celebrating, and it's also worth rededicating ourselves to seeing this project go forward. Many partners, including the town of Garner, wonderful to be locating this in the town of Garner. The location for a new acute care facility, but the real thing today is this mental health care and the mental health facility, which is what's new, and it's what Garner, the town of Garner, is going to be hosting very hospitably. Deborah is right. She and I made this a priority as we were working up our appropriations wish list in the last Congress. Started out as a couple of different requests, and we combined them and increased them and came up with what you see. It was a joint request, and it was included. I can remember very well when it was a done deal. It wasn't on the October 1 start of the fiscal year, unfortunately. It was on December 22nd, virtually on Christmas Eve, that omnibus appropriations bill got passed, and it was not a sure thing. But at that point, we all, I'm sure, including WakeMed, breathed a sigh of relief because this appropriations item, along with others, was then going to be a reality. Now, this isn't the first time WakeMed has sought funding for this kind of need. In fact, Christine and I were trying to identify the exact date, and I didn't dig through the files sufficiently to confirm it, but it was at least 15 years ago when we were seeking mental health beds. There was an appropriations item for mental health beds sponsored by WakeMed that involved Holly Hill and kind of expropriating facilities so that this need could be met. And it was a desperate need even then. So this kind of funding is unique. I don't know where else in the federal budget you could direct funding in quite this way. Unfortunately, the kind of funding we're talking about, it was at least 15 years ago because it was a 10-year hiatus. There were 10 years after the 2010 election when the new congressional leadership eliminated this kind of funding. And we brought it back 2 years ago. We brought it back 2 years ago, and now with another change in leadership, I think it's highly likely, in fact, it may already be true, that a project of this sort will now be declared ineligible.
They said only 30% of our requests would be granted.
Well, a small percent of the requests, and then also no labor HHS project. That's outrageous. That really has to change. But I think it does give us a sense, phew, we made it over the line. At least with this request, and there need to be more, of course, where this one came from. I'm pleased that we and the WakeMed leadership, and there were a lot of folks being attentive to this, that we were able to get this over the line and to secure the down payment, which with the county's announcement today, which will follow mine, this is already proving to be catalytic funding, bringing forth the kind of support we need from other sources. Now, everybody today has said it, and we've all said it because it's true. We face in this community and in this country a crisis in mental health. A crisis in mental health. Our hospitals don't have enough beds, and other institutions are bearing a burden that they are not equipped to bear. Emergency facilities, law enforcement, schools, prisons. And the result is, let's not forget, untold human suffering. That is the result of this. I think seldom do we have a chance to address a more serious and enduring problem than the one we're addressing today. And it is about human well-being and human suffering. So I'm not going to say we're solving that challenge here today, but I'm going to say we're taking a serious and significant first step. And the satisfaction that I feel as someone who represented all or part of this community for a good many years, I do have to say I'm very, very happy to see WakeMed take this step and to see the partners come forward. And I'm pleased with what I would regard as an exemplary example of Congress's power of appropriations, the power of the purse. How better could it be used? So thank you for that, and thanks to everyone who brought us to this day.
Thank you so much, Congressman Price, and thank you so much to Mayor Marshburn and Congresswoman Ross. What you said, Congressman Price, about this being a homecoming really does resonate with me. It's wonderful to see so many partners and friends here today to celebrate. And that's exactly what this is. It's a celebration. So my name is Shinica Tomas, and I am the chair of the Wake County Board of Commissioners. My fellow commissioners, Vicki Adamson, Don Mile, Cheryl Stallings, Matt Calabria, and former Commissioner Sig Hutchinson are all here today. But we are extraordinarily lucky that we get to work with many of the leaders here today regularly on all kinds of solutions. But today is special. Today we can celebrate the power of true partnership. Today, we can reflect on the deep impact that this new facility will have on our citizens. Citizens who society has long ignored, or even worse, shamed. Today, we get to learn more about the life-changing, high-quality care our neighbors will be able to access. Today is a really exciting day for all of Wake County. And I say all of Wake County because nearly all of us have been impacted by mental illness, either a friend or a colleague or a family member, or even personally. Mental health concerns can be some of the most confusing and difficult to navigate. The diagnosis can be complex, and accessing the right care in the right time can be incredibly difficult. Unfortunately, we know the need for high-quality mental health care is growing exponentially. Earlier this week, my colleagues and I received results from a new behavioral health crisis system study that Wake County commissioned. And while we heard some good news, that we have a generally healthy community and committed leadership at all levels, the critical need for a campus like this is clearer now than ever. From 2018 to 2022, there was a tiny increase in overall emergency department encounters at our 3 local hospital systems, less than a 0.25% bump. But in that same 4 years, we saw a 40% jump in the number of encounters with primarily a mental health diagnosis. That's thousands more people who desperately need the right mental health care. And we also know that these health concerns disproportionately impact our Black and brown populations, folks who have a good reason to be nervous about seeking health care. But the data also makes it clear that no population is immune to mental health concerns. It impacts our young people, like we've seen too many times already this year. It impacts our older folks. It impacts both men and women, people with comfortable bank accounts and people without a penny to their name. Everyone is impacted by mental health concerns. And so that's one reason why WakeMed is truly a perfect partner to take the lead on the next step of improving mental health care in Wake County. WakeMed is known for taking in every person who shows up in need of care, regardless of their ability to pay. And on top of that, WakeMed's extensive network of providers means that they'll be able to get patients linked up with excellent supports for long-term care management. When WakeMed came to the county requesting $6 million to partner on this mental health hospital, we knew that it would be a perfect fit. And while treatment for the mind may be complex, the solution is what we professionally call a no-brainer. The tricky thing about behavioral health care is that there isn't just one leader, y'all. No one entity can take responsibility for the whole system. No one group can make improvements that our people need and deserve. It takes all of us. I always say that we are better together, and it's only together that we will help residents in Wake County get better. So, again, I'd like to thank all of the partners here today for their commitment, from our fantastic municipal partners and economic leaders here in Garner to our state partners who quickly assisted with a certificate when they recognized the need. Thank you all. Thank you to our federal level leaders. Congresswoman Ross, Congressman Price, your work championing our people is invaluable, invaluable. WakeMed leaders who went to bat for this need, thank you all. I know it took countless of hours of work to get here, and you'll put in many more hours, we know. But I'm proud to stand with you all today and say that in Wake County, every citizen's well-being is important and worthy of high-quality care. I look forward to seeing you all again here in Garner in a couple of years. I cannot wait to celebrate the opening of this groundbreaking facility. Thank you all again for this celebration today.
Good morning. I'm Micah Krempasky, and I'm a psychiatrist and the Chief Medical Officer for Mental Health and Wellbeing at WakeMed. And I just want to stop right this minute and take this all in. For my whole career, I've waited on a moment like this. I wasn't always sure that it would happen, but I dreamed of it. And so I just want to express profound gratitude for being here with each and every one of you today in the name of mental health. It's really amazing. Over the past year, WakeMed had the opportunity and privilege to serve 4,000 people who walked into our doors on the darkest days of their lives. They came to us seeking hope and treatment and help. And just like we always do, we leaned in for every single person. We heard their stories, we heard their needs, and we shared our resources freely to help them. Yet, even with doing that, we weren't always able to meet the needs that they had. We recognize that there's a shortage of resources in our community. And when people need an inpatient psychiatric bed, we can't always get it for them. And they don't get the care that they so desperately need. The pandemic really heightened that for us, and we became increasingly aware that our community needs and deserves more mental health care. So it's in that spirit that we're stepping up. We're stepping up and we're leaning in. But we're not leaning in the traditional ways of mental health care because they haven't achieved the outcomes that we so desperately want. They haven't gotten us to where we want to be. So we're leaning in a different way. We're leaning in a way that supports whole person care. Sometimes I'm kind of astounded that whole person care is a novel concept. We have long understood the connection between mental health and physical health. But yet our health system is designed to treat them separately, and we put different emphasis on it. But with whole person health, we start to recognize that health is more than blood pressures and blood sugars and heights and the dreaded weights. It's so much more. It's about whole people and everything unique and special about us. So we're leaning in to address whole person health care. And with that will be our mental health hospital. But again, not the mental health hospital of the past, not like the traditional psychiatric units in America that are hidden in the corner with poor visibility and poor accessibility. No, our mental health hospital is going to be the crowning jewel of this campus. It's going to proudly sit next to the acute care hospital, and it's going to unabashedly welcome people into its doors and celebrate the beauty of helping and supporting mental health. This hospital is not going to look like the ones had before, but rather it's going to embrace all the concepts that make us healthy. It will have a gym so that we can support the idea that exercise is part of health. It's going to have a dining area so that we know people can experience the joy of breaking bread together, and that we can educate and support people in making healthy eating choices. What we put in our body is what we get out of our body, and if we eat well, we feel well. It's going to have access to outdoor spaces so that we can continue to share and celebrate the healing power of nature. It's going to have spaces for families to come in and join us and be a part of the healing journey, because the power of relationships and support systems is incredibly important in health. And it's going to welcome people of all ages, children, adults, the elderly. We'll have specialized programs for them all. It will welcome people of all walks of life. Mental health is non-discriminatory. And we will welcome into our unit and our hospital people whose stressors include wondering where they're going to eat and sleep that night. And we'll welcome in people whose stressors center around million-dollar businesses. We will welcome everybody in the true WakeMed spirit. And we are very excited for that privilege and that opportunity. Today, we have a special gift for our speakers to say thank you for all that you've given us and for your time and your insights and your wisdom. Oops. It's a sun catcher. It goes here. I broke it holding on to it. It's a sun catcher, and these sun catchers were handmade by the Moorfield family. The Moorfield family lost their bright light Isaiah to suicide and depression. And in their grief, they started making these sun catchers as a way to distract themselves. But they realized that the sun catchers were way more than a distraction. but they were actually about healing and about sharing light with others. Isaiah's mom, Rachel, is here with us today, and we're so honored to have her and to use her story as inspiration of why we have to do better and why this work is so important to us. Thank you so much for being here with us today. Thank you for your time, for your support, and for your generous gifts that have helped us on this journey. They mean the world to us, and they mean the world to our community. Every 11 minutes, someone dies by suicide. So we've been here over an hour. At least 6 people, the statistics would tell us, have died by suicide. 6 families are forever marked by losing someone to suicide. We, our families, and our communities deserve better. We want better, and together we're going to achieve that. So thank you for being on this journey with us, and now let's go build a hospital.
I don't think I've ever streamed before, but now that I'm streaming, thank you all for joining us today. Thank you, those that are in Streamland, for watching. You heard about the money. It's going to take this. There's a reason that there aren't mental health services, because there ain't a lot of money in it, right? So if we're going to do what we set out to do, it's going to take all of us. It's going to take federal support. It's going to take county support. It's going to take state support. It's going to take the hospital to support. It's going to take this community to support it. With that, as you've heard, we can do things that will transform the lives of thousands and thousands of people. So, coming to a QR code near you, your opportunity to support. But in the meantime, please know how much we appreciate what you do, what this community does, how much we work together, and hopefully you're inspired by what our board had the vision to support, what our team had the vision to create, and what our partners had the vision to embrace, and it offers hope. So God bless y'all. Have a great rest of your day. Thank you so very much.
Thank you, Sean.
My pleasure.
Forgive me for that.